Welcome everyone to our LifeBulb webinar focused on transplant medication. My name is Karin Hienberger. I am the president of LifeBulb, and I'm really honored to be here today with Jeanmarie, one of our community managers and a kidney transplant recipient. Today, as I mentioned, we are going to talk about the medications transplant patients take to prevent rejection. And that is something that all transplant recipients have to take for the rest of their lives. Jeanmarie, a few words about yourself, and then we can start talking about the meds.
My name is Jeanmarie. I was diagnosed with lupus when I was 16. I experienced just extreme fatigue at that time and back pain. I was listed on the transplant waiting list when I was 22, and my father was my donor and had the kidney transplant when I was 24. So it has been 18 and a half years since my kidney transplant.
It's interesting you've had your transplant, and really congratulations to a successful transplant. It's taken you from end-stage kidney disease now to living life without need for dialysis and so on. So that's wonderful what transplantation can do for people. And I know you give back so much, and not just to LifeBulb, but to other organizations as well. And we really appreciate that. So when you went through the transplant, do you remember how you were educated or told about the medications that you would be on and what they do?
Yes, I was still in the hospital. I want to say it was like a few days after the anesthesia wore off.
Yeah.
And it was almost like a class. I had several doctors come in and the pharmacist come in and explain what each medication did and that I would be taking them for the rest of my life.
So it was the doctor who educated you, the nurse, or do you remember who was sharing all
I
that with you?
do. Yes, it was definitely, it was like a little team.
Mhm.
There was my surgeon, my father's surgeon, the pharmacist, and I want to say it was the charge nurse or someone who was on the floor of the transplant recovery area. And I think that was also because she was also giving me the medications and making sure I understood what they were. And as the days progressed before I was discharged, they would quiz me on them before I was actually discharged. So I really, really knew what my medications look like, the dose, and also aware that they will change over time.
That's really remarkable. That's good education, and it's nice they followed up during the time that you were in the hospital, which is a good time to keep you captive to education. Do you remember what you were on when you were in the hospital in that beginning period from transplant?
Been almost 20 years, but I'll do my best.
Yeah.
There's definitely Tacro, like Tacrolimus. That was the big thing then. Like it was Cellcept at the time. A lot of like antifungal medications as well. That transplant center did not do prednisone at that time, although I am on it now.
Mhm.
But there definitely was not the steroids at first. There was some stomach medications and vitamin type stuff, and there was a lot. I'm going to say there was probably like 20, 25 pills that I was taking at first.
Yep, that's a lot. And
Yes.
how often, do you remember how often you took your pills a day?
I'm going to say that it was at least 3 times a day I was taking medications at that time. Some of the medications you couldn't take together. So there was morning, noon, and night was kind of the regimen at the time.
And you mentioned that you also were on antifungals. You probably also were on antivirals and
Oh,
antibacterials, because in the beginning, after the transplant, you're quite immune suppressed, because after a kidney transplant, you're normally also placed on an IV infusion daily for maybe 3 to 4 days. It's called thymoglobulin, and that suppresses you more than what you will be suppressed over time. So over a period of time in the beginning where you're extra immune suppressed, you're normally treated also preventively with an antiviral, an antibacterial, and an antifungal, in addition to the chronic kind of maintenance therapy that you described as Tacrolimus and MMF, which is a very typical protocol for any transplant center. I think currently about 30–40% of transplant centers use steroid-free treatment protocols, which yours was part of. Just from a practical perspective, when you took these drugs, did you kind of put them in a pill box, or did you open the different boxes for each pills 3 times a day, or how did you organize all that? Because if you have 20 to 25 pills, it's a lot to remember.
During my educational pharmacy part, they actually gave me a big, huge pill separator thing, which had morning, day, and night. So that's how I did it at first. And it
Mhm.
was very, very helpful. We already loaded it all up for about 30 days before I left the hospital. I felt like that part of the transplant, I was really educated on.
The 30-day pill organizer, that must be huge.
It was like it was huge because there was huge pills. I want to say like Valsite was really
Yes,
large,
very big.
there's like large pills in there.
On MMF. Yep. You know, you often hear when patients describe pills, you describe the size and the color, right? When you got your first, pills sent to your home from the pharmacy, you had to kind of reload it.
Yes, but by then I was very familiar with what everything kind of looked like because 30 days of looking at my pills, because then I can only take like 2 at a time and not the 10 at a time that I can take now. But it was very helpful having it all set up like that because I was very well aware. And at first, I never thought, wow, well, what's the point of knowing what all of these medications look like? But I've had over the years the pharmacy fill the wrong prescription.
Mm.
So I think that it's important for everyone to really know what they look like.
Yeah, that's really good. That's really good. And everyone can make mistakes. I totally get that. But when the pharmacy makes mistakes, that could be truly dangerous, really dangerous. So I'm glad you spotted that before you took the wrong pills. It had catastrophic consequences. You've now been on this journey for close to 20 years. And have you seen any innovation or new drugs that are being presented to you by your center that could replace, as you said, your Tacrolimus or your MMF? Have you switched drugs over this period?
Yes, I've also tried in the beginning, I think year 2 or 3 different ones, and they did not go over well. After my first rejection, that's where the steroids came in at. But now I am on the Prograf, but now I'm doing an infusion of
Mhm.
Belatacept. And the reason why we did that about 5 years ago, I think it was, and it was still pretty new-ish, is my kidney was just getting very complacent with current medication. So they thought, okay, this could kind of get things even out again.
So they switched you from a TAC MMF regimen to a TAC plus Belatacept or Nologics regimen.
Yes. Yes.
So they removed the MMF and or Cellcept mycophenolate. Okay. Did they lower your Prograf when they did that?
Yes. So at first I was taking 2 milligrams, 2 and 2, and now I'm at 0.5, 0.5. And so generally we try to keep the level between 2 and 3.
Let's talk about Prograf because it's something you've been on for close to 20 years. Have you experienced any side effects with Prograf?
Yes. I'm gonna say probably about year 2 or 3. Initially, I did not. I didn't notice anything. I don't remember taking a lot of Prograf. I feel like that changed when they took me off the MMF because they took me off completely because I was having GI issues.
With the MMF.
So yes,
A lot of patients have GI issues with MMF.
yes. So took me off of that, increased my tacro. So then kind of started having a bit more of tremors and such. Kind of got used to it, and we figured
How
out the
does tremors, just because not every patient understands, how does that manifest, the tremor?
I still have them pretty uh not right now.
You're not
But
nervous.
I know, but my hands will just shake, but it's not even like, the shaky of being cold. There's this uncontrollable different type of feeling, like it's almost painful
Hmm.
in a way, like irritating. Like my hands will feel irritated. I'll know when I'm having tremors.
So what is kind of a practical application of that? If you were to hold a mug of tea or coffee, would that be difficult? I mean, how does the tremor affect you in daily life?
Maybe I'm just kind of ignoring it, but I to
Yeah,
me it's just something I have to deal with.
that's
So
interesting because as you know, I also have a kidney transplant, and for me, the tremors, I know when I don't feel the pain, but I know when I have to use two hands to hold a glass. Like if I hold a glass and I have tremors, I have to put a second hand because otherwise I'm going to drop the glass. And that is a clear indication that Prograf is too high. If you imagine, if you have a profession where, fine motor skills are really like critical, then that tremor could hurt your way of living. And the tremor is an indication of, an effect of Prograf on neurology, like on your nerves and your nervous system. So normally when you have tremors, there's also an effect on, for example, inability to fall asleep, that you feel a little bit anxious, you could have headache. Have you seen any of those symptoms with Prograf when you had higher trough levels?
Yeah, I would even say it feels like high anxiety, like I have
Yeah.
extreme anxiety. There's been a few times where it's been a huge issue. One time, like when I changed my diet, apparently my metabolism changes when that happens, and so did my Prograf level. They shot up like crazy when I stopped eating junk
So
food.
Jeanmarie, that's a really good example for our audience, that the metabolism or the breakdown of Prograf can be affected by what you eat. So if you change, I think you've moved to plant-based diet, right? So that may not be as much to work with for Prograf. Suddenly your trough levels went higher. And
Very high.
yeah,
I think it was around like 15 or 16 because I happened to be in the grocery store and I had to leave the grocery store. I felt like I was going to just kind of pass out. Like my whole body felt like it was shaking. And so I went to the car and I called the doctors and they're like, oh, get to an emergency room. And I did. And nothing else was wrong except for my tacro level. And the emergency room didn't think to test for that. It was the transplant center. So that was a toxicity, medicine toxicity or something.
yeah, yeah. So they probably lowered your dose.
Significantly. And then they were checking my dose, I think like twice a week for quite some time, till probably I got used to my diet. But I'll notice it. I'll know now I notice when it is high.
That's a good illustration of how tacrolimus, and it's a great drug. It preserves, that function because it will reduce the risk of rejection. So Belatacept that you talked about, that you have now added to your low dose TAC regimen, is an IV infusion. So you said once a month you get that?
Originally it was once a month. I think I've been getting it once a month for about 4 years, and now they just switched it to every other month. So there's been no change in anything. I'm still pretty stable at the 15%. And it's a very simple infusion. I don't really mind it.
How long does it
No,
take?
about 30 minutes. It
Mhm.
usually takes, I get it at home, and it usually takes the nurse longer to set up than it takes to get the infusion. Sometimes I get a headache after, but not a crazy headache. And I think that has to do with being hydrated correctly. But otherwise, I don't have any other side effects from it.
That's great. That's really
Yeah.
great. Belatacept has been shown to keep the kidney more functional over a longer period of time than tacrolimus in some patients. It's an interesting new therapy, but of course needs to be combined with other therapies as well. You talked about MMF. Just want to go back to that because that is another kind of core staple in the transplant treatment regimen. And I know you said GI issues. I know GI issues may not be the most pleasant to describe, but do you want to just describe what happened?
Biggest problem was nausea and diarrhea. Every day, no matter what I ate, the nausea was probably the most annoying part, mostly because I worked with the public. So it was very hard to pretend that I was always feeling well.
Yeah.
And it went on for a long time. They couldn't figure out what was wrong actually at first. And then one of the doctors called when he was on vacation. He goes, I know what it is. It's the MMF. And I want to say about 2 weeks after I stopped taking it, all my symptoms went away.
And you also said diarrhea. So was
Yes.
the diarrhea in conjunction of taking the drug, or would it be all through the day?
The nausea would stay throughout the day, but the other issue would just be primarily after I took the medication.
And the problem with that, of course, is that you lose fluids through the diarrhea and you can't take in nutrition because of the nausea. Your tacrolimus levels will increase because you don't have enough, to work with, and your kidney function will be reduced because you don't have enough fluid. So it's definitely not good consequences, but it is the drug of choice often to be combined with. You mentioned steroids, and you were on steroids for a period of time. They're of course a very broad immune suppressant. And how did you take the steroids and how did you feel with them?
Initially, it was through IV. during the first rejection episode. I want to say I was taking the pills for a few weeks after the IV. Then a few years later, after my second rejection episode, is when I did IV steroids, and then I've continued taking low dose of steroids ever since.
Mhm.
So still on them.
Still on them. And how do they make you feel, if at all? Do you feel that you're taking them, or have you had any side effects?
I feel like I'll have a moon face if I'm really not careful with what I'm eating. And that's where I started being careful with my diet. I felt like my body was processing sugar and carbohydrates differently. And with that, I started gaining weight. Then I didn't want to exercise, and it became a vicious cycle. So that's how I became plant-based, and then lost a lot of the weight and was able to have the time to exercise. But I begged to get off of that every time, and they, no, no, no. But
Yeah.
they said it's not just for the kidney, it's also because of the lupus. It keeps the lupus quiet as well.
You know, we often forget that a transplant is a treatment for, an end stage condition that is triggered by another condition. So, in your case, it's lupus. So the underlying disease of lupus is still there. And one of the manifestations was that the kidney failed, but you still have to treat the lupus. So it doesn't affect the new kidney or other parts of your body. So it's a really good reminder that transplantation is kind of not a disease. It's a treatment for something that has been caused by another disease. In the whole journey with transplantation, the drug portion, how do you kind of list that on the nuisance, the level of difficulties? I mean, is that part of something that you are bothered by? And I want to distinguish between the practical aspect of it, taking the drugs every day, remembering that. That's one. Getting access to the drugs through a pharmacy, through insurance, number two. And then number three, how you feel when you take the drugs, meaning the side effects. Those three components, how do you feel about that when it comes to your overall transplant perspective?
I'm so programmed now, over 20 years of just
Yeah.
taking it. But thinking back in the beginning of transplant and going back into the workforce, I can't tell you how many times I would forget to take my medications because
Yeah.
I was busy working. I worked with the public, so I couldn't just stop and take my handful of medication. So that was a big adjustment for me to try and figure out how to do that. And remembering now we have apps and things and watches that help. That's nice. However, you have to deal with the pharmacy, which is usually a specialty pharmacy. And then, depending on how efficient they are, you get your medication on time, or you have to keep following up with them. And then there's the nursing staff, the nursing company. If the nursing company is not staffed properly, then that becomes a big issue, and another hours and hours on the phone as well. So it's probably one of the hardest parts of having a transplant, I would say, for me, because there's first making sure that the medications are filled properly, making sure that there's no insurance issues. I've spent probably more time on the phone with insurance companies and the pharmacy, more hours than I would like to.
Yeah.
I mean, a lot of hours. I mean, there's been times where I'm just standing in a parking lot crying on the phone with the insurance because they won't cover the anti-rejection medications because of paperwork issue or whatever it is on their end. And their solution has always been, well, contact your transplant center or go to the ER. And I'm like, that's horrible. That to me is the most stressful part. I get very, very nervous when I don't have at least 30-day supply of my medications. The anti-rejection, anyway, really, really upsets me. Or when I get the notification that it's on back order. That's happened a few times, and there's nothing we can do about it. Or I'll be on the phone with all different pharmacies trying to get my prescriptions filled. So hours and hours and hours of time trying to get the medication. So there's that part of it. The side effect part is constant side effects or GI issues. Again, the GI doctor has a hard time right now because he's like, I can't take you off of your medications and treat the issues that are going on. You just have to wait things out. So that's another really difficult part. Maybe because I was very young at the time, but I did not anticipate this is what it was going to be like. And maybe I thought, oh, transplant's a cure. I'm going to be fine. So over the years, I've realized it's not. It's a lot of work. It's a lot of work.
Yep, yeah. Finally, we have talked a lot about the short-term side effects, but when you were educated around the drugs, I'm sure they mentioned to you that by suppressing your immune system, you have risks for certain cancers and infection. You know, is that something that has affected you or you are worried about as well? And how do you kind of prevent or treat that?
I think it's just the preventive care. I actually, in a way, it's kind of a blessing because I'm really great at going to my mammogram appointments, my dermatology appointments, every single type of preventive type situation, I'm on top of it. And
Mhm.
I kind of feel better because I know that things aren't going to get completely out of control. If I didn't have a suppressed immune system, I probably would never go to the doctor.
Yeah,
So,
that's a really
yeah.
good point. There are some, we have to see the blessings in these things, right? Because you're probably going to detect something earlier than if you didn't have it. You may be at a higher risk, but you will detect it earlier. So that's great. Are you worried about infections in large settings? Do you feel vulnerable or how do you deal with that?
It's hand washing. It's not putting my hands to my face. I've worked with the public for so long and pre-COVID that I had to make sure I was not having to still wear a mask before I went back to work. I just always had hand sanitizer, constant hand washing, not touching my face. I kind of do this little backup thing with if I feel like people are standing a little too
Yeah.
close to me, like a subtle backup. So it's so dramatic or rude. And I will say that over the 20 years, I've been pretty fortunate. I've had two things of the flu over the years, which is not too bad for working with the public. And viruses, I've had them here and there, but they seem to have been things that I already had. And that shingles, I got shingles twice. So right now I'm dealing with like a stomach virus. So that can't go away completely because of the immune problem. So I don't want to be worried. I want to still
Yeah.
live my life. I don't like crowds because of anxiety, but I still love being around people and the energy. And that to me is living. If I'm risking, I would rather do that than be stuck in my house all the time.
Totally agree with you. So, Jeanmarie, what makes you happy right now with your transplant? What makes you feel really happy during the day, any one day?
The beach and hugging my nieces and nephews. There's nothing better than little hugs. Hearing them laughing and just to me, that's life. Like it's just living. It's the happiness, it's the connection, and the beach is just always alive. And I think that's why I just love the ocean. If I'm really feeling down, I just put my feet in the water. I don't know what kind of medication is in there, but it
And
always makes
that's
me
what
feel better.
yeah, that's what makes you happy. And transplant has given you the opportunity to enjoy that.
Yeah.
So, and thank you so much. I really appreciate this discussion. We learned a lot. And it's so nice to hear the personal kind of story behind the drugs and how you perceive them. And it's very valuable. So thank you, Jean Marie. Thank you so much. Bye.
Bye.